Welcome back to the class Hara Diagnosis, Introduction to Kiiko Style, the AVI way. In part 1, we looked at the map of the abdomen, the neck and the back, and we saw the treatment protocols for these reflex areas. It can appear like we can simply palpate the abdomen and follow the clues in the abdomen, and then just clear the reflexes that show up on the patient. Certainly that is useful, but it is not the best application of the style. For one thing, what happens when a patient shows up many findings on the abdomen? If we chase each reflex and apply the protocol for that finding, we will end up with many needles, and we might also not really get to the bottom of the question of what is at the root of this patient's problem. In order to help us correlate the information and prioritize it, we use the medical history combined with the abdominal findings to try and find the so-called root. In that process, it is very useful to find what we might call the patient's type. It is similar to the way a homeopath might look for a constitutional remedy. When we find the root type of the patient, their constitution, treating that should move everything else. Classifying patients as types may feel a bit unholistic. We pride ourselves on being holistic and treating individuals, and looking at a person as a type can feel like we have put them into a box. But in order to treat people, we need to be able to do that, and to recognize that people do come in certain major flavors, so to speak. We're all unique, and at the same time, we're all quite similar and have similar tendencies, needs, and obstacles. In this part of the class, we will go through the different types, categories of patients. When we have identified a patient type, it means that we also have a treatment idea for that type. There is no point in declaring a patient to be a Kundalini moving sideways type if we have no way to address it. So we list types and treatment protocols together. If you are an adrenal type, it is not just because you show pressure pain below kidney 16 at 4 o'clock and 8 o'clock and have a history of shock, but also because the adrenal treatment, say kidney 6 and kidney 27 or kidney 7 and 27, resolved these reflexes and created improvement in your symptoms. A patient can embody more than one type. They can be autonomic nervous system type and also a thyroid type, with both needing to be addressed at the same time. However, if you have given a patient more than 3 types and are trying to address all of them, I believe you're really likely to be faced with limited success with that patient, and you may need to rethink and reanalyze the patient. We have many different types or categories that we can treat. They will tend to fall into some broader categories, like hormonal disorders, immune system disorders, circulatory disorder, nervous system disorders, things like that. In other words, they're influenced by our current medical understanding. We also have a spleen type, a liver type, a cardiac type, a lung type, and our adrenal type is somewhat equivalent to the kidney type. These reflect the Chinese medical understanding. With time, as our understanding expands, we develop more and more types. For example, a genetic or a DNA disorder type. That these types reflect new understanding of the medical models available. If you're very confident about your pulse diagnosis, you can also look at pulse types. Personally, I utilize the pulse as a contributing factor, but my ability is limited and I'm not able to confirm the diagnosis or point selection by detecting corresponding changes in the pulse. So I use pulse types as a general guide and do my treatment confirmation using the abdominal reflexes. A type, or a category, is basically a way to explain what system is weak in the body. It may come with clear reflexes, but it may not. For example, the autoimmune type or the diabetic type do not have clear reflexes associated with them. The type might be based on a set of symptoms or on a Western diagnosis. What is essential to a type is that we can identify it in some manner, be it via the pulse, the abdominal findings, Western diagnosis, a set of symptoms, whatever. It is also essential that we have a set of treatment points to address that type. Otherwise, it is basically useless. There's no point in classifying a patient as type X if we have no way to treat it. While a patient may officially fall into a particular type by all indications, if you are unable to treat the patient using that type's treatment ideas, it is no longer useful to think of that patient as being of that type. Ultimately, the patient's type is going to be determined by what points best treat him or her. My only interest in diagnosis is if it leads to a treatment. It is also important to remember that the different types do interact, and many patients will present as a mix of a few different types. The key is to find the main type, or up to 3 types, that will clear the abdominal findings and the symptoms. The symptoms, because that is what the patient came for, and the abdominal findings, because it gives us confidence that the treatment is actually affecting the whole system and not symptomatic. That means it has a much better chance to last. There are infinite types, possibly as many types as there are living people. However, there are some obvious types that most people tend to fall into. It is entirely possible that there are other common types that are not used in the system, or in medicine in general. And this is because our knowledge of medicine is limited by our generation's understanding of the sciences of the human body. Just like there was no thyroid classification in the 16th century, and yet people must have had thyroid problems that went undiagnosed or untreated, there must be types out there that we're unable to diagnose because our paradigms and understanding are still lacking in that area. Currently, our medical understanding is shifting towards a more and more microbiochemical model. However, we are still using the model of the major systems of the body that we call respiratory, digestive, nervous, endocrine, immune, cardiocirculatory system, etc. Accordingly, most of the types you see here are following this kind of model. Of course, our current understanding is that these systems are not standalones and that each affects the other through subtle signals and feedback mechanisms. When we look at the types, we're looking for the following: the circulatory types, including blood pressure type, cardiac type, stomach chi type, the anemic type, basilar and brachioradial congestion types, things like that. Some of these, as you can see, are also structural types, like the basilar artery type. The immune types include things like people have lots of allergies, the weak immunity, as in having tonsils removed or having lots of colds and flus type, the autoimmune type, the hyperimmune type. The endocrine types include the estrogen insufficiency type, the thyroid type, the pituitary or the birth control pill taker type, the sugar metabolism type, and the adrenal type. The nervous system types, which tend to be extremely prevalent, include the blood pressure disorder type, which are both circulatory and can be nervous system types, the insomnia, the anxiety, depression, panic attack, and worry types, the vagus nerve congestion type, which is also a structural type, etc., etc. Structural imbalance types include things like tailbone injury, head injury, people with TMJ, a tight SCM, type scalenes, viscertosis type, where the organs are falling onto the inguinal ligament, the scoliosis type, the person who has a twisting syndrome around GB26, and many other types. I personally add another type, which is the sinking type, or we might call the mushu type, which would be considered a subcategory of structure. Due to our training, most of us gravitate towards the 5-zone model first. So I will go through those 5 types first, as they are easier and more comfortable for most people. You will see that we actually are referring to the actual organ when we say lung or liver in the modern biomedical sense. And only in the case of the spleen is there a stronger correlation to the Chinese energetics that are behind it. The cardiac type refers to the physical heart, and it is not referring to the heart as in the mind. It includes not only those with cardiac ailments, but often patients whose family history shows a lot of heart disease. I ask about parents and grandparents, and if even one of them had a cardiac disorder, I would start to consider this one as a possibility. If 3 of the ancestors had a cardiac disorder, the possibility of the patient being a cardiac type must be considered seriously. They may have no cardiac symptoms, but the genetic disposition to a weakness, if confirmed by any of the reflexes, suggests that their cardiac disposition needs to be addressed and may be the root weakness that is leading to the current symptoms. Cardiac reflexes include REN17, REN15 when pressed up and towards the left, the kidney line on the chest on the left side, left stomach 18, left pericardium 1, which I take more on the base of the breast rather than once and off the nipple, left spleen 20, left small intestine 11, and the left inner border of the scapula, UB42 to UB45 area. Of these, left small intestine 11 is the most indicative. Pressure pain or puffiness on left small intestine 11 and none on the right is a sure sign of cardiac presentation. Before treating the heart itself, there are 2 cases that we need to watch out for. The first is the patient with a short and weak pulse, that pulse that has no chirp position. In that case, we must first use spleen 6, spleen 9, and pericardium, checking pericardium 8. If there's pressure pain on pericardium 8, treat pericardium 3 and 5. Otherwise, treat pericardium 6 or pericardium 4. This is to build up the blood, because you do not want to get the heart to pump more strongly against a vacuum. This type tends to tire easily and may have stiff shoulders. The other type is the edema type, water accumulation in the legs. If a cardiac patient has edema, the water must be moved first, before the heart is being pushed, because you do not want to push the pump against an edema that will push back the flow. In these cases, we treat spleen 3, spleen 7, and spleen 11 in order to get the water moving. Once those needles are in, we can continue with the treatment. In other words, it is not as if we wait until the pulse is full and strong or there's no more edema. That can take weeks or months. We get the process started, and once there is some movement, we can address the heart. This is all done in one treatment. In a cardiac patient, it is important to distinguish between slow and rapid pulses. Use REN4 for the rapid or regular pulse type. Use UB27 for the slow pulse type, as well as the normal type. Do not use REN4 for the slow pulse type. Use the point under the second toe in the center of the crease where the toe meets the ball of the foot for rapid pulse types. Check UB60, especially on the left. If there is pain on UB60, use UB66 and 67 metal and water points. If there's no pain on UB60, needle it upwards against the channel. At the end, once you have completed the treatment, having softened and shrunk the puffy area on small intestine 11 as much as you can, and the rope on the inner border of the scapula, you can needle those and do OQ, direct moxa, on them. Surround small intestine 11 with 3 to 5 needles and do direct moxa on them. Needle the inner border of the scapula towards the scapula, that is laterally, and also do OQ there. It is important that you reserve this part of the treatment to be the last part, so that the whole body and all other issues are being addressed first before you do any direct stimulation of the heart. Remember to always check rapid versus slow pulse in cardiac patients. Also, if you want to use spleen 3 or spleen 4 to address any issue in the patient, who has chest disorders, that is heart or lung problems, consider the pulse first. If a patient has a small, weak pulse, we would tend to use spleen 3 and consider it an ischemic problem. We believe that spleen 3 sends blood to the heart. If the patient has a big, strong pulse, spleen 4 is indicated. We consider this to be an enlarged heart type, where blood needs to be sent away from, not into the heart, and spleen 4 does that. This is a rule you may decide to override because either spleen 3 or spleen 4 seems essential for the treatment and the other one does not do the trick. If you opt to override this, I suggest you remain with the patient for a few minutes and when you leave the room, remain vigilant. It has happened that patients who got the wrong spleen point complained of chest discomfort during the treatment. Nagano said to not treat the abdomen in patients with a slow pulse. This makes sense, as activation of the abdomen tends to slow the pulse, and a slow pulse type does not need to have the pulse slowed down further. I avoid abdominal points, especially lower abdomen, on slow pulse patients. With a rapid pulse, according to Nagano, it is wise to avoid the spine. This has been quite confusing, and over the years I've heard different ideas as to what this might mean, and with many exceptions being created. My own solution to this rule has been to needle less on the back for rapid pulse type, and to be observant and pay attention once I leave the room if a rapid pulse is getting lots of needles on the back. But I will avoid doing too many needles on the back with rapid pulse. For the irregular pulse type, I add gallbladder 39 and gallbladder 5. These are called Xuanzhang, the suspended bell, and Xuanlu, the hanging skull. The character Xuan indicates that the heart, the mind, is suspended, which is what happens when a regularly irregular pulse is there. For this reason, these points can also be used in cases of stroke where it was the mind that got suspended. The lung type includes people who are prone to or have asthma, repeated bouts of pneumonia or bronchitis, emphysema, TB, etc. The bronchial reflexes are not lung 1 for us, but rather the kidney line on the chest on both sides. Note that left side only tends to indicate cardiac, but it also indicates lungs. If only the left side shows, this may still possibly be a lung issue and not cardiac, where the reflex is only showing on the left. But usually, if it shows only on the left, we were likely to assume this is a cardiac reflex. Lung 1, lung 2 area might show on some people, but more typically, we can find pressure point on the edges of the sternum. Right stomach 26-27 can show up in people with lung problems also. Be aware that many people with asthma do not show this. In fact, Oketsu, left stomach 26-27, has been shown to be far more prevalent in patients in TB sanatoriums. The blocked lungs create a sluggish, mucky blood flow. On the back, the lung type will show puffiness, gumminess, and pressure pain on UB13, UB42 area. Many lung types will have pressure pain on lung 10. Recall that we take lung 10 right behind large intestine 4, so it is on the thinner eminence flesh and not on the bone edge where TCM takes it. The treatment for the lung type will always involve lung 5 or lung 8 or both if lung 10 is painful on that side. Both points are needled superficially and down towards lung 9. Our lung 5 is not on the edge of the tendon, but more lateral to it, where you might feel a slightly puffy tissue. Sometimes we may go slightly above or below the elbow crease, but we never go right next to the tendon. For inhalation problems, use kidney 4, needled towards the heel. Inhalation is supposed to be rooted in the kidney. The kidneys grasp the chi. The name of kidney 4, Daojang, the great bell or the great clock, indicates a connection to metal. Zhang shows a servant striking a metal, thus a clock. The two organs that have a regularity like a clock are the lungs and the heart, and the lungs are also the organ of metal. There is a Taoist idea that the authentic person, the cultivated sage, breathes all the way into the heels. On people with a strong awareness of the breath, one can feel the breath in the medial part of the heel, that is, at kidney 4 area. You can also think of sitting in Padmasana, lotus, where the heels pressed against stomach 30. This way the heels are activated with every breath. The Nanjing speaks of the exhalation as coming from the Chang. That is, in exhalation problems, we use spleen 4. For a patient who has both inhalation and exhalation problems, start treating the inhalation, the kidneys first. Once that is improved, and if the exhalation problem is still there, you can start using spleen 4. On the back, the target is softening of the rhomboids, the UB13 area. The points on the front, or possibly above the greater trochanter, help release the rhomboids. By creating a separation between the legs and the torso, we allow for the chest to expand more and not be bound by the sinking down into the legs. You can use more than one needle here. Look for the gummy and tight spots on the edge of the trochanter. Kiiko likes to find these points with a patient on their side. This makes it easier to find as it exposes the trochanter. I needle them with a patient facing up, checking their effectiveness on all the reflexes, including anything found on the abdomen, as well as the chest, the kidney line, and UB13, which I can still reach and palpate even though the patient's lying face up. Once the patient is turned over, face down, start with small intestine 9-10, meaning a point between small intestine 9 and small intestine 10, needled out towards the deltoid. You will find a spot that feels tender, that tends to feel both tight and feels differently than the tissue that surrounds it. This should soften UB13 area. Yao Yan, the lumbar eye, the dimple in the posterior iliac crest, also releases the rhomboids. Needle this point towards the leg, meaning down and possibly slightly outwards. After all these have been addressed, as well as any other issues and reflexes the patient has, the final target is the area of UB13, which may include UB12 to UB16 and extend from the spine all the way out wide to the scapula. Once you soften this area as much as you could with remote points, you can needle it and apply OQ, direct moxa, on this area. You can see that with the chest organs, the puffy tissue that accumulates in the back is not just a reflex. It is also a physical obstacle to the organ and needs to be treated and dissolved directly. Other points to consider in lung problems are UB17, which we call asthma shoe or autonomic nervous system shoe. The diaphragm line clearly influences the lungs as well as the nervous system, and the lungs and heart are highly susceptible to nervous system in the form of spasms, fibrillations in the case of the heart. Kawai's combination for coughing is also quite useful for lung problems. This is Du14 Huatou, which is Ding Chuan, UB13, UB17, or T7, and UB20, or T11, T12. If I choose the bladder points, those are needled downwards. If I choose the Huatous, they're needled at 45 degrees towards the spine, or 45 degrees towards the spine and upwards. If you're true to Kawai style, all these points would be used with Kyutoshin moxa on a metal-handled needle. This is often called warm needle technique. I personally do OQ, direct moxa, on these points and find it is just as effective. You are looking to dissolve the heart tissue, and OQ does that very well. With regard to oxygen supply, we consider the following points. Lung 8 is considered to supply oxygen into the blood, and we use it when blood oxygenation is not good. For example, if there's numbness, we use spleen 3 and lung 8. Lung 4, which we take where the nose touches the arm, but this is done with the head being brought down to the arm, not with the arm being brought up to the nose. This lung 4 is about 3 ton above lung 5, and we consider it to be oxygen supply to the lungs, meaning it allows better capacity and expansion of the lungs. UB42, needle towards the scapula, is considered to supply oxygen both in the blood and in the lungs. The spleen type comes in different flavors. People who bruise easily, have varicose veins, those who've had their appendix removed, who crave carbs, all tend to be spleen types. Of course, with any digestive disorder, look at the spleen as one possibility for being the primary weakness. A typical spleen type is pear-shaped. They have large buttocks and thighs and much thinner at the waist and above. The guy in this picture is clearly not a spleen type by this measure. We have two main spleen types. The spleen 9 type includes people who've had an appendectomy or gallbladder 21 pressure pain. This will be pain on one exact spot at gallbladder 21 and not a diffused area along the trapezius. The person with bloating that shows full palm pressure just above the inguinal groove is also a spleen 9 type. We needle spleen 9 superficially, parallel to the skin, upwards towards the knee. A spleen 9 type will tend to be chubby at spleen 9. There will be some flesh to pinch here, and hence we can afford to needle it upwards this way. A person who's very skinny at spleen 9, where the area between the inner knee eye and spleen 9 is basically skin tight on the bone, is not likely to respond to spleen 9 treatments as much, and it is hard to needle there. For the appendix type, on the right side, spleen 9 will be combined with spleen 5, the metal point, making it into a metal water treatment. The other main spleen point is spleen 3. This is the type that loves simple carbs and sugar, or has pressure pain on the scalenes, or has muscular pain, muscle cramps. Note that I needle spleen 3 just off the bone. What one might call it that it's slightly towards spleen 4, and some people actually name it spleen 3.2, but to me it is basically spleen 3. It is a point that I needle with a thin gauge needle as much as I can, usually a 0.12 gauge, the dark green handles, and a shorter needle, 15 millimeters. But a 0.16 gauge 1-inch needle is just fine. Needle at an angle that points slightly towards spleen 4. Spleen 3 is a point that resonates with OQ, direct moxa, especially if the foot is cold. On the back, I use T11, T12 Watteau for all spleen types. Note that there are other spleen types. The spleen 7 type, where there is a pitting edema and a hole on spleen 7, which is taken right behind the bone, touching the bone. This is used for people with edema in the legs to move the water, as well as it is a stop bleeding point, for example in fibroids. Nagano considers spleen 7 to be a spleen point that resonates with kidney functions. Spleen 7 also has a strong affinity to OQ. The spleen 6 type is the anemia type, in which case it is combined with pericardium 6, or the headache type, with a headache at the top of the head. Blood pressure disorders are also considered to be in the spleen domain and treated with spleen 6 and spleen 9 both, as well as pericardium. The liver type shows pressure pain on liver 14, or more typically, under the ribs on the right side. On the back, the area of UB17 and 18 will be raised and or painful. Some liver types also show pressure pain on right liver 2. While the typical spleen type is supposed to be the pear shape, the typical liver stereotype is the apple shape. That is, a big round abdomen with skinny legs. These are caricatures of the types, and many spleen types and many liver types do not show these characteristics. In fact, many liver types are actually quite thin and wiry. But people who are clearly apple or pear-shaped tend to fall into their types fairly consistently. The liver type may have clear liver damage, hepatitis, cirrhosis, etc., may have been exposed to toxins, may have a history of alcohol consumption or of various drugs, for example, long use of antibiotics or blood thinners, which result in liver deficiency. Unlike TCM, we do not classify the irritable type as a liver type. We are referring to the physical liver organ. Liver type often comes with right C3 neck pain. As the liver is pressing on the diaphragm, the feedback on the phrenic nerve reflects on C3 on the right. Liver types may also show pressure pain on right UB43, Gao Wangshu. Gao is fat. It is important to distinguish between the liver excess and liver deficient type. The liver excess types feel sharp pain upon pressure on liver 14 or under the ribs. The liver deficient type might say dull pain or weird. Some people cannot define what they feel, or there is a mix of sharp and dull pain. Say liver 14 is sharp, but under the ribs feel dull. The mixed or undefined type needs to be checked for both treatment options. The treatment that most effectively eliminates the liver reflexes and other findings will determine our final thinking as to whether to call it deficient or excess. For physical liver damage, such as hepatitis, cirrhosis, radiation damage, etc., we use right side kidney 7, spleen 7, heart 3, and pericardium 4, 3 fingers below pericardium 3, all on the right side. This comes from Nanjing 75, where it is stated that liver excess is not treated through metal lungs, as would be expected by the idea of metal controlling wood. Rather, Nanjing 75 suggests tonifying mother and reducing son, that is, tonify kidneys and disperse the heart pericardium. This reflects the understanding that liver excess always involves a deficiency, and that liver blood must always be protected, a strategy that is universally followed in liver dredging herbal formulas, which will always contain tangwei or baishao to nourish the blood against harsher drainers like, say, gardenia, jitsu. Kidney 7 and spleen 7 represent the nourishing kidney part of the strategy. They are both needled at a slight angle upwards with a meridian flow. Remember that spleen 7 is a spleen point with kidney functions. Take spleen 7 right next to and behind the bone. Some TCM people might think of it as liver 6 area, the Xi point of the liver channel. In fact, Etienne Ni once asked me why I did not use liver 6 for hepatitis, and when I showed her what I did use, she said, "Ah, your spleen 7 is exactly my liver 6. Our, what we call liver points, are on the bone and not behind it until you reach the 8-zone mark. The heart 3 and pericardium 4 represent the reduced sun part of the equation. Because we do not drain the heart or the pericardium, we still needle heart 3 and pericardium 4 down with the meridian flow. This was Nagano's treatment for atomic bomb radiation victims, and it has been extended to other liver damage problems. This treatment is used for people with high liver enzymes showing in blood test. It is also used to improve blood counts for cancer patients undergoing radiation or chemo treatments. Another liver excess type may show pressure pain on liver 2 on the right side. In that case, use liver 4 and liver 8, both on the right. The alcohol or family history of alcohol type, those whose family have consumed alcohol for many generations, will tend to fall into this category. Some patients who are born into alcoholic families and do not touch alcohol can still fall into this category. the liver weakness has been transmitted to them. Sometimes, after liver 4 and liver 8, we might needle liver 2 against the channel, towards the big toe and down, manipulate the needle, and then take it out. The third liver excess type comes with mouth sores. We consider mouth sores to be a liver excess rather than stomach fire. The treatment for this type is liver 3 and spleen 3, both needled bilaterally. Liver 3 represents the liver involvement, while spleen 3 represents the area, the lips and mouth, that is a spleen domain area. The liver deficient type shows dull pain on liver 14 and or under the ribs. Or they might say that when you pinch the skin under the ribs, the right side feels weird. You will feel that when you are pinching, you are picking up more skin on the right side. You might say it feels thicker. Some deficient liver patients will say that they feel more pressure under the ribs on the left side. This is because the left side feels normal and the right side feels numb to them. In non-tropical countries, you can assume that the right side is the problem side because it is rare to have malaria, dengue fever, or other diseases that attack the spleen, which is a lymph organ. If you are in a tropical country, you cannot rely on this diagnosis, since the pressure pain on the left side may well indicate a physical spleen damage as a remnant of chikungunya, malaria, or dengue. Liver deficiency is treated with liver 1. Note that there are several locations for liver 1, several options. Just like pericardium 9, the other Jingwell point of a Jue Yin, both Jue Yin Jingwell points are unusual in location. My favorite liver 1 is the one that one would take if one took it as a regular Jingwell point. That is the liver 1 of 1 in the picture. Kiiko tends to like the one at the center of the big toe, or the one in the medial side halfway between the nail and the crease. I always check all liver 1 options, but I naturally start with what is my favorite, because it is likely to yield results for me and save me time. No need to check the others. Note that you are likely to develop your own preferences. So you need to find out which liver 1 tends to work for which patients, and if there happens to be a liver 1 that's going to work for you as a whole. Patients that have right side UB43 pain will also tend to be liver 1 types. Liver 1 tends to be a better point for patients with a rapid pulse. The fatty liver type is diagnosed by values such as high cholesterol, or we assume it is a fatty liver in obese patients. Bad fat metabolism accumulating fat, therefore it is assumed that the fat is in the liver tissue also. The fatty liver treatment for the regular patient is right stomach 25 and right liver 13. For an obese patient, we start with left gallbladder 26, left stomach 26, 27, Ren 6 in the center, and then right stomach 25 and right liver 13. We would omit Ren 6 if the pulse is slow. In an obese patient, the fat resists the propagation of needle stimulation. It is as if the mass of fat pushes against the needle. Therefore, we need to provide more oomph to our needles, give it an extra spark, or shuttle the effect further with intermediary points. In an obese patient, we will add a point above the knee to help shuttle the points that are below the knee. If you use spleen points below the knee, add spleen 10 or spleen 11. If you use kidney points, use inner yin 5 fingers above kidney 10. If you do not shuttle the effect, the points below the knees may not be as effective. In the treatment for fatty liver, we initiate the treatment on the left as if to give it an extra spark before we get to the right stomach 25. Patients who are exposed to toxins or radiation are often treated with kidney 9 and large intestine 15. You can check both points against the liver as well as stomach 9, the thyroid. When it comes to toxicity, the liver and thyroid are both affected and should be checked for any cancer patients undergoing chemotherapy or radiation or have had those in the past. When none of these treatments work, or for the undefined liver type, meaning it was neither deficient nor excess or showed both, the points to consider are kidney 9, gallbladder 28, needle towards the leg, down and outwards, and the dent to the right of DO20, between the bladder Taiyang channel and the gallbladder Shaoyang line. Originally, this point was defined on the left side. Level with DO20 go between gallbladder and the bladder channels, and this was on the left side defined as the malaria point or spleen treatment point. Over time, we found that it actually affects the liver also when we use it on the right. For all liver types, on the back, use left UB35 to release right side UB17-18 area. UB35 is named Hui Yang, meeting of Yang, and the left side represents the rectal vein. T7 DO9 is called Che Yang, reaching Yang. The 2 points have a clear affinity. Meet the Yang to reach the Yang. From the liver on the right, we can move back along the portal vein to the left side at the small intestine and then down into the rectal vein. Liver cirrhotic patients often have hemorrhoids due to rectal vein congestion that was created due to the blockage of the blood in the liver, transmitting through the portal vein to the rectal vein. Therefore, needling UB35 on the left sends a signal up towards the liver on the right. The kidney domain in this system is dominated by the adrenal type. This revolves on the axis of the kidney medulla and cortex. An adrenal type is a person who has gone through a shock or several shocks, or who has slowly exhausted their adrenals. Although in the point numbering system, it appears as if the kidney channel moves up from kidney 11 up through kidney 16 to kidney 27, it in fact does not. From the perineum, it moves up the spine. At the level of the navel, that is kidney 16, it moves forward and down to meet the kidneys and the bladder. That is, it moves from kidney 16 down to kidney 11. From the kidneys at kidney 16, it then moves up towards kidney 27. In other words, at the kidneys, one branch moves down and one branch moves up. This happens at kidney 16. When fear or shock affect the kidneys, a jolt or separation of those two branches happens, and it will reflect just below kidney 16 because fear descends. Therefore, adrenal type shows its pressure pain on 4 o'clock and 8 o'clock, just below kidney 16. Pressure pain on kidney 2 can also be an indication of adrenal type. The adrenal type often has a valley back, that is, tight paraspinal muscles in the lumbar region, which when the patient lies face down, makes it appear as if the spine is in a valley that is surrounded by tight paraspinals on either side. Hormonal types can also show a valley back. TMJ and acne on the chin are also considered to be adrenal types. The thyroid and the SCM are part of the kidney trajectory and are released and treated by kidney points. The original adrenal treatment is kidney 6 and kidney 27. Kidney 6 is needled towards the Achilles, and kidney 27 is needled towards the center. Kidney 6 can be substituted by other points, but kidney 27 is always part of this treatment. Kidney 27 is considered to subdue the parathyroid. When the adrenal gonad axis is weakened, the parathyroid gets stronger and leaches calcium out of the bones. That is why when we strengthen the adrenals, it is important to subdue the parathyroid with kidney 27. If you find pressure pain on kidney 2, you should use kidney 7 and 10 metal and water points on that side. Note that kidney 2 might be painful on one side, but not on the other. The slow pulse type tends to resonate with kidney 7. Hypothyroid type may do best with kidney 3, needled towards the Achilles. If there are lung issues involved, it is possible that kidney 4, needled towards the heel, will be the best choice. In people with brain injuries, you might find a small nodule just above kidney 3, which will be needled upwards. For TMJ, neck problems, goiter, and detoxification, kidney 9 is often chosen. Kidney 9 is often the point of choice in the adrenal treatment when there are emotional reflexes showing also. Kidney 9 is the beginning of the yin wei, which enters the heart. Whatever point or point combination you chose, it will be combined with kidney 27. Note that each side may have a different lower kidney point. Choose the best point or points in accordance with what clears abdominal reflexes best. It is said that kidney 6 is meant for cortisol, that is, cortex issues, while kidney 7 and 10 are related more to adrenaline epinephrine issues, meaning to the medulla, and have a stronger connection with the sympathetic nervous system. But the choice should really be made not on the theoretical idea, but on the body findings. If there is pain on kidney 2, which points clear the most adrenal reflexes, etc. Still, when you find pressure on kidney 2, it is important that you also check out the upper thoracics, because they communicate with the adrenal medulla, and other signs of sympathetic dominance, should be looked at. On the back, consider either the sacroiliac treatment to release the valley back, and or use of UB52 needled towards the spine. Other kidney types have to do with the physical kidney. The kidneys are hard to palpate, but they may show around spleen 15 in cases of kidney failure. Kidney 16 may reflect the kidneys also, but not so much in that we're actually touching the kidneys or an area just above them, because they're more lateral, but in that this is where the channel enters and exits the physical organ. The treatment for physical kidney issues is kidney 7 or kidney 9, or kidney 9 plus what we call detox kidney 9, which is 3 fingers below kidney 10. This detox kidney 9, in spite of its name, is not used for detox except when you're detoxing for pain meds, for morphine. For all other detox, we use the regular kidney 9. Kidney stones will show on gallbladder 26 area as pain when that area is being tapped. You might say this area reflects the urethra, where the stones pass onto and create the pain. Use UB28 for that. Another very common type is the immune type. This patient may have a history of tonsillectomy at a young age, frequent colds and flus, nasal allergies, back pain across the width of the posterior iliac crest, or back pain that is aggravated when arching the back, and also temporal headaches. They will tend to show pressure pain around Sanjiao 16, in back of the SCM, an area that reflects lymph nodes, and possibly they might show right stomach 26-27. This type has a strong correlation with the appendix type, since the appendix is an immune organ. They have a correlation with the lung infection type, and the spleen 9 type, and at times with the stomach G type. The main point to use is the immune point. It is between large intestine 10 and 11, closer to the Sanjiao channel on the edge of the bone. On the back, you might use DO 14 and DO 12, either the DO or the Huatou points, with moxa. Combine the immune points with other points according to what other types are being correlated. For example, with the spleen 9 for appendix type, or nasal allergy type, or with lung 5 for the lung type, etc. Weak ligaments are also correlated with weak immunity, and we use the immune point often for knee injuries or inguinal ligament issues. Related to the immune points are the lymph clearing points below the scapular spine, below small intestine 12, needled upwards towards the bone. You can use 2 or 3 of those. These points are used for lung infections and upper torso lymph congestion. The immune points, including DO14 and 12 and the lymph clearing points below small intestine 12, all resonate well with Okyu moxa. There are no clear reflexes for the autonomic nervous system in the body. It may show as tightness on the SCM, creating a vagus nerve blockage. A tight SCM can constrict the vagus nerve, which is a parasympathetic nerve, and this deprives the organs of parasympathetic feed. A tight diaphragm can also be an indicator of a tight nervous system, and because of the diaphragm, C3 might show up also. There may be tightness on liver 12 at the top of the thigh and pressure pain on REN 17 and REN 9. On the back, there may be tightness on the upper thoracics, T2 to T7, especially at T5 and 7, as well as tightness on the inner border of the left scapula. The occiput might also show tightness or pressure pain in autonomic nervous system disorders. In long-term nervous system disorders, the adrenals are being taxed also, and kidney too may show pressure pain. Classifying a patient as autonomic nervous system type is a bit tricky because we do not mean that they are emotional or psychological cases, but rather that the nervous system does not adjust the sympathetic and parasympathetic components easily. It is a bit like saying that the nervous system does not have good tone or good flexibility, and rather than balance sympathetic and parasympathetic feedbacks, it gets stuck in one mode, unbalanced by the other. Patients with nervous system disorders might have palpitations, insomnia, sweat easily, they might get easily startled, they might experience anxiety, depression, or panic attacks, and they might have unusual blood pressure, quite often low blood pressure. A constant sympathetic dominant patient may also experience digestive disorders, both with eating and with elimination, as both functions require parasympathetic input. One type of patient I often classify as nervous system type is the patient who is unable to say if a reflex gets better when you press on a treatment point. They get confused. They start comparing one reflex to another, or the feeling of pressure on the treatment point compared with the reflex, etc. They just find it impossible to give a straight answer to, is this better? We tend to think of sympathetic dominance as the culprit, especially in today's fast-paced lifestyles. However, there are also people with the opposite problem, a parasympathetic dominance. These may be people who have spent so long in sympathetic dominance that the sympathetic feedback got weakened, and what is left now is only parasympathetic feed without a balancing sympathetic feed. This means that the brain and extremities are given less blood, and the digestive and elimination systems are being activated. The patient will experience cold hands and feet and may have overactive intestines or bladder, as well as heartburn, as the parasympathetic feed is encouraging peristalsis and stomach acid production even when there is no food. Nagano felt that the rapid pulse indicates sympathetic dominance, while a slow pulse signifies parasympathetic dominance. I do not feel this is very accurate on my patients, but it is one guideline to consider. Nagano also described a pulse associated with nervous system disorders, the tight pulse. A tight pulse may be described by TCM practitioners as thin and wiry, but a true wiry pulse is supposed to be an excess pulse, so thin wiry is a bit of a contradiction. Tight means that there is tightness in the pulse. That is the quality that it shares with the excess wiry pulse. What makes the tight pulse indicative of nervous system disorders, though, is that when you press deeper, that quality, that tenseness disappears, and the pulse becomes wider, possibly even hollow, and in some patients, the pulse disappears altogether. It is that change between the surface being tight and the deeper level that defines this pulse. Note that this is not the same tight pulse as defined by Li Shijian, where the pulse vibrates from left to right. In treating the nervous system type patient, first differentiate between slow and rapid pulses. Because we do use different points for slow pulse than those used for rapid pulse. With regular rate pulse, you can choose either. The main point for sympathetic dominance is the point under the third toe, at the center of the crease where the toe meets the ball of the foot. This point is used for patients with a tight pulse. It is not a good point for a patient with a slow pulse unless they clearly have a tight pulse, a tense quality that changes or disappears upon pressure. This is also our main point for blood pressure disorders. The point under the third toe releases the occiput on the opposite side. Release the SCM by using opposite side Sanjiao 8, 1/3 down from the elbow. If the pulse is slow or regular, use opposite side Sanjiao 8, but if the pulse is rapid, use Sanjiao 5 on the opposite side. Use the pericardium channel. Check pericardium 8. If it is painful, use pericardium 3 and 5, water and metal. If pericardium 8 is not painful, you can choose between pericardium 6 and pericardium 4, 3 fingers below pericardium 3. Pick the point that clears the most reflexes. For a rapid pulse, you can use REN 6, which will often clear REN 17 in the autonomic nervous system type. Liver 12 is also a point that can be used with a rapid pulse. Liver 12, 静脉, is called the rushing pulse. On the back, use DO2, needle superficially upwards. DO2 should clear any pressure point on the left inner border of the scapula, which reflects the pacemaker, part of the autonomic nervous system. Small intestine 9-10, needled up and out towards the deltoid, is an important point for nervous system type patients and can clear findings in the upper thoracics. T5 and T7, or the insomnia shoe, which is the area of UB16-17, are also used. Or look for pressure pain all around from T2 to T7 and choose the points that show either puffy or pressure pain. There is a correlation between the thyroid and the nervous system, so always check for thyroid involvement. Also, always check for adrenals. There is a strong correlation between the adrenal type and the nervous system type, because the adrenals are involved in stress hormone secretion. There is an axis of continuity and relationality between the immune type, the adrenal type, and the nervous system type. When someone has weak immunity over a long period, the strain of it will eventually affect the adrenals and weaken them. And that will then start to pull on the nervous system. This is not a one-directional relationship. Weakened or hyperactive adrenals will start to strain the immune system and also strain the nervous system. And a non-adjusting nervous system will drain the adrenals and the immune system. Any one of these components can be the starting point that affects the others. The blood pressure type is often closely related to the nervous system type. In abnormal blood pressure, the diastolic blood pressure can represent a parasympathetic state, while the systolic can represent a sympathetic state. Normal blood pressure should have about 40 millimeter mercury between diastolic and systolic. We are concerned not only with people with high blood pressure, who are usually aware of it, or people with low blood pressure, who might be unaware of it, but also with people with unusual pressure differentials. For example, a person with a blood pressure of 125/65 would not fall into a high or low category, since 125 is an acceptable systolic and 65 is an acceptable diastolic, and yet the gap is too large. The same holds true for someone with a blood pressure of, say, 105/80. Taken alone, neither number is problematic, but the gap is too narrow. The body is not adjusting well. Blood pressure types do not have a unique reflex in the body that reflects the blood pressure issue. The diagnosis of this type is made from a blood pressure exam. Most patients will be unaware of the actual numbers if they do not have high blood pressure. However, I suggest getting the actual numbers, as opposed to, "It's good," which is what patients will often say when they do not know. This is because I'm looking at abnormalities in the gap, as well as low blood pressure, which often people do not know they have. Some blood pressure types will show pressure pain under the occiput, and in extreme cases the area may be puffy, but that is not always the case, and those signs can be related to nervous system issues that are unrelated to the blood pressure. The treatment for blood pressure types is under the third toe, the point that is under the third toe where the toe meets the ball of the foot in the center of the crease. Then spleen 6 and spleen 9, with spleen 9 being needled upwards towards inner knee eye, and pericardium, meaning check pericardium 8 on each side. If it is painful, needle pericardium 3 and 5 on that side. If pericardium 8 is not painful, choose between pericardium 6 and pericardium 4, which for us is 3 fingers below pericardium 3. On the back, use UB17 and small intestine 9-10. Another very common type nowadays is the patient who has a pulse on REN9. When you press on the abdomen, you should not be feeling the pulse. The aorta is just in front of the spine, so it should not be felt in the front. If you're feeling the pulse, it means the mesentery tissue is not toned, allowing you to feel the pulse. This is considered to be a weak dantian. A REN9 pulse may also show in people with strong emotions that cannot be expressed. It is an indication that the inner heart cannot contain the emotions, and they burst out into the blood, into the vessels. It is common to find left spleen 20 pressure pain in patients with a pulse at REN9. The original treatment for REN9 pulse was right side stomach 24, which is named slippery flesh gait. Why, yo men? The right side is the blood side. It is needled at an angle that is slightly towards the lateral side. Later, left gallbladder 26 was added to this treatment because of the left spleen 20 finding. Gallbladder 26 releases the pectoralis. This treatment seems to work for some. However, I have found this not to be as useful as I would like it to be on most of my patients. My preferred treatment is Mushu, the point that is level with REN4, taken all the way out to the side below gallbladder 26. I can then add right stomach 24 if it is needed. In both treatment options, it is not common to totally diminish the pulse right away, but in my experience, Mushu does a better job. Furthermore, Mushu will tend to resolve more reflexes than just REN9, usually far more than right stomach 24, at least for me. On the back, a REN9 pulse type is treated with UB52, needled towards Mingmen. Thyroid issues are also very common, especially in women. Because of its metabolic role and effect on all cells, the thyroid plays a major role in health and disease and needs to be addressed when found. The thyroid reflects around stomach 9, on the middle of the SCM, as well as on the lower part of the SCM. Being an endocrine gland, and being that the kidney channel circulates in the throat, thyroid issues are considered to be in the kidney domain. This is a difference in thinking relative to TCM, which views the thyroid as related to the stomach or heart fires. Always check the thyroid in cancer patients, anyone exposed to radiation, or others with toxicity issues. In those cases, also check the liver, as the liver also may be involved. Check thyroid on all women. The thyroid treatment involves use of kidney points. The official treatment for hypothyroid is kidney 3, needle towards the Achilles. The official treatment for hyperthyroid is kidney 7, and for goiter it is kidney 9. However, you need to first check kidney 2, the fire point, and determine the kidney points to be used according to kidney 2, as well as according to the effect that the chosen point has on the throat and or any other reflexes. The stomach chi point, the bumps along the stomach channel below stomach 40, can also be useful. In hypothyroid cases, activate the DO. Hypothyroid can be said to be a yang deficiency, and the DO is the C of yang. We use DO 2, needled upwards, T11, T12, needled upwards if using the DO, or if using the Watteaus, go in and up. T7, DO or Watteau, and T5, DO or Watteau. You may add L2 as well. Note that Kiiko expresses this combination as DO 2, Mingman, T11, T12, and T9 and T4, rather than T7 and T5. If there is an autoimmune issue, like Hashimoto's, it is important to address that also. If there is toxicity, kidney 9 and large intestine 15 should be considered. Another very common type is the so-called sugar type. The sugar type likes carbs. It may not be sugar, but they are drawn to things like bread, pasta, or other grain products. Many sugar types will tell you that they do not touch sugar because they know that sugar may trigger fatigue or headaches or body pains in them or aggravate some other symptom. Many of them are unaware of the contribution their simple carbs consumption is making to their discomfort. There is no reflex on the front that indicates a sugar type, except in insulin-dependent diabetics who can show a tight rope just left of the navel. Kiiko used to like to call it the sugar lump. On the back, the sugar type tends to have some puffiness at T11, T12. It is as if a piece of chewed gum is stuck onto the side of the vertebrae, feeling it, making it feel puffy when you touch it. Spleen 3 is our main point for sugar types. On the back, T11 and T12 are used, possibly more than one needle, and Ocumoxa is applied. For diabetics of any kind, the treatment is spleen 3 with the addition of the adrenal treatment, that is kidney 6 and kidney 27, and the immune point and the OD point. The OD point is the point that is halfway on the line at 45 degrees drawn between the navel and the right ribs. Halfway, 45 degrees line between the right ribs and the navel. It is called stomach 22, Guanmen, the gate of gate. Though it is not precisely on the stomach channel, we still use that name, and this point represents the OD sphincter. For the diabetics, we use T11 and T12 on the back. Diabetes is a primary type. Diabetes affects all cells and all systems of the body. A diabetic patient, no matter what their complaint is, should in all probability be treated for diabetes as one of the main primary root treatments. When the diabetes treatment, spleen 3, adrenal, immune, and OD, is in place, there is a good chance that all their reflexes and symptoms would have improved, and then more can be added to the treatment if needed. but always start to look at the diabetes treatment if the patient has diabetes. Recall that there are no reflexes for diabetes except perhaps the puffiness on T11, T12 on the back. So you're using this treatment to try and clear whatever reflexes they have, reflecting whatever other issues. For diabetics, also consider autoimmune involvement and also consider treating fatty liver. Spleen 3 is also the main point that we use for muscular pain. Sugar consumption sends signals to the muscles that there is energy available, and now the muscles are getting ready for activity. And this cycle of sugar spikes can leave the muscles in either permanent contracture, spasms, or in atrophy mode because of the yo-yo effect of the high and low sugar levels sending signals and activating and deactivating constantly. Sugar also is a contributor to inflammatory conditions. The OD point, halfway between the right ribs and the navel, is used for any muscular pain also, as well as for any pain that feels like a bruise. Sugar types tend to show musculoskeletal pains more on the left side, so when a patient complains on left side symptoms, you can look at cardiac options and/or sugar possibilities. Lack of stomach chi is a relatively prevalent type also. The two main indications for the stomach chi type are lack of stomach chi in the pulse and bumps along the stomach channel on the chin. Lack of stomach chi pulse is a pulse that is hitting your fingers without a forward movement. It does not have the feeling of a wave moving forward towards the thumb, but of a pecking upwards only. That lack of a wave quality, some people might call lack of slipperiness or softness in the pulse. The bumps along the shin are below stomach 36. Originally, we looked for bumps below stomach 40 and attached to the bone. Do not look for the bumps on the lateral side of the tibialis anterior, the second stomach channel, where some people needle stomach points. Those bumps are attached to the bone. Stomach 41, needle towards kidney 6, is part of the stomach chi line and was the original point used. It is normal to use 3 to 4 bumps and needle them down and towards the bone. Ocumoxa is often added. Symptoms associated with the stomach chi points are knee pain, especially patella pain, leg and foot problems, especially neuropathy, problems involving seasonal changes or time adjustments, and bending and stretching musculoskeletal problems. However, this list is not the main reason to include stomach chi, but rather the pulse and the bumps, which indicate a weakness in a central organ system. Therefore, it is very common to add these points to a treatment or to the start of a treatment, because until the pulse gets a fuller wave, the body may not respond to other treatments. You can feel the pulse with one hand and then press on the stomach chi point on the left and feel that the pulse is changing, becoming more rounded. We always use the stomach chi points on the left first and then on the right, because the left side is the chi side, moving the chi before moving the blood. Stomach chi naturally goes along very well with spleen 3, and the two types often come together. Another major type is the autoimmune patient. Because this is a systemic inflammation, it affects all the systems in the body, and as with the diabetic and thyroid types, we would treat this as one of the roots. Regardless of what the patient comes in for, if they have an autoimmune disease, chances are we will start out with the autoimmune treatment and then add to it. There are no clear reflexes that we say indicate an autoimmune disorder. However, it is common for autoimmune patients to have a gummy, puffy sacroiliac ligaments and also have puffiness at the mastoid bone. When you observe a red-orange hue on the lower throat and collarbones, ask about the possibility of an autoimmune involvement. I find this to be quite reliable indicator, although it does not mean that all people with autoimmune disorders have that coloring in the throat and upper chest, only that people who do have that color are likely to have an autoimmune disorder. But like in diabetes, the diagnosis comes from the Western doctor. For autoimmune disorders, it is important to distinguish between the rapid and the slow pulse types, as the treatment points are different. The principle of the treatment is to clear systemic inflammation using systemic metal water, and that means using the kidney and the lung channels. Then we also use the small intestine, the yang of fire, mu or shu points. In a rapid pulse patient, use REN4 plus kidney points and lung points. You will choose which kidney points to use according to which ones release the most reflexes. And if there is pressure pain on kidney 2, you will use kidney 7 and 10. Otherwise, you might use kidney 6 or 9. Originally, we said to use 2 kidney points. Choose between kidney 6 and 7. And then also choose between kidney 9 and 10. I often choose just one. On the lung channel, we used to say use either lung 5 or lung 9, but I find that either lung 5 or lung 8, or both, are more common for me to use. REN4 cannot be used if there is an inflammatory process clearly happening in the abdomen, such as in cases of Crohn's or ulcerative colitis. In those cases, you can use Mushu as a substitute for REN4. That is, take the level of REN4 and go to the sides below gallbladder 26. Also, do not use REN4 in cases of a slow pulse. The slow pulse treatment is the equivalent of the back. UB27, the small intestine shu, just like REN4, the small intestine mu. This is right on the puffy gummy that is typical in autoimmune patients and feels like a soft-moving ping-pong ball. Then adding UB23 or UB52, representing the kidney part, and UB13 or UB42, representing the lung part. While the original protocol implied an either-or, I tend to use both the front and the back treatments, but I do not use REN4 when the pulse is slow. If there is a history of high fever, add Ihikon. This is UB60, needled up against the channel, UB58 and UB40, which is really taken more like UB39, and I actually take it above the crease on the lateral edge, kind of like UB38, and I needle it towards the fossa, that is medially. Kiiko tends to take UB39 and needles it straight in. Ihikon is a combination we use for head injuries as well as for fevers. For the rapid pulse type, also check the effectiveness of small intestine 1 and 2 and UB66 and 67 and use it if appropriate. DO16 can be added for all autoimmune types. The hormonal type refers to estrogen imbalance type. You may get the clue from the medical history or the symptoms, including headaches, especially above the eye, cold feet, since estrogen dilates vessels, so insufficiency of estrogen can result in constricted blood flow, and any signs associated with a menstrual cycle and symptoms that appear following hormonal manipulation. Again, this is a primary type because of the effect on all cells in the body and all systems. It is not a treatment to address only menstrual or reproductive issues, but a route for many other disorders that may seem unrelated. Of special note are women who have taken birth control pills for long periods, or even for short periods, but stopped due to adverse effects of the pill. The hormonal type reflexes are UB2 and the occiput, UB10 area, as well as just above the occiput, and small intestine 13 may show up as well. I also find a strong correlation between a hormonal type and bumps or sensitivity on the inner thigh above the knee at inner yin. The treatment point of choice is UB66, water on water, representing hormones. The name of UB66 is Zutonggu, the leg connecting valley. Tong is to penetrate, to connect. It implies mediating or diplomacy, which describes the role of the hormonal system. It mediates. Kidney 10 is also water on water, and it is the companion of UB66. I personally often will substitute and use kidney 7 rather than kidney 10. If the diagnosis is correct, UB66 should clear not only the occiput and or UB2, but also other abdominal reflexes which are not related to estrogen, but are affected by the hormonal imbalance. I also add inner yin, 5 fingers above kidney 10. Perhaps that is why I tend to use kidney 7 over kidney 10. This is an area clearly associated with hormonal imbalances. I needle inner yin towards the stomach or gallbladder channels. Once UB2 has no pressure pain on it, it can be needled also, and Yu Yao can also be added. On the back, UB32 is considered women's point and is used, and possibly small intestine 13. Recall that Liao is in Sil Liao, UB32, implies the ability to penetrate. It is the sound of wind whistling in a conch, and hence it relates to the penetrating capacity of UB66. External hormones, such as in birth control pills, can play with the pituitary since they disturb the body's feedback mechanism. In those cases, use small intestine 3, the master of the do, to affect the pituitary. Of course, small intestine 3 is also somewhat of a hand equivalent of UB66. Note that the main menopause treatment for hot flashes is adrenal, plus spleen 9 and gallbladder 34. Spleen 9 needled upwards and gallbladder 34 needled towards spleen 9. And then add gallbladder 28 in the inguinal towards the leg and out. And it can also include UB66 if it clears symptoms or reflexes. Cysts of fibroids, while they may be a hormonal type, are first and foremost considered liver A types, as cysts and fibroids are considered a liver deficiency. Also, remember that not all menstrual or reproductive issues are hormonal or primarily hormonal in nature. Circulation and other issues can be primary roots in many gynecological complaints, so always check the inner thigh, liver 12 area, the inguinal, the piriformis, and the sacroiliac ligaments for tightness. Also remember that the hormonal type is often applied to many problems that are not gynecological at all. The patient may have digestive issues, structural issues, or any one of myriad of complaints, and if they are a hormonal type, by something in the medical history or perhaps pressure pain on UB2 or 10, then look at UB66, etc. to resolve the problem. It simply means that the hormonal issue is intertwined with the problem the patient is presenting now, not that the patient must have a current hormonal issue. We have seen the major types of this style, at least as I currently understand patients. As time passes, we all find different types to be more or less prevalent, and in 10 years this list may be quite different, all depending on the patients we see, the culture we live in, the medical understanding we gain, etc. This is not some final list that all patients must fall under. There are also dozens of more minor types that might be major for particular patients. We will go through some of those next. However, before we continue, there is one type that is not part of the system, but yet I find it to be very prevalent. I call this the sinking or lack of uprightness type. Before there are 5 phases, or the organ system, there is the interaction of yin-yang, which produces the 5 phases. The human connects heaven and earth, and it is that connection that creates the space for the organs. Many people sink down, so there is no interaction between heaven and earth, and the whole torso is pushed down, giving no space to the organs. The person will fall down and back at T11 and 12, and the abdomen will have no lift in it. This is lack of perineal floor awareness, and comes from not using the inner legs, the chow line. So the lift in the perineal floor is not being created, and then that is not supporting the spine, and the end result is being tension in the head, the neck, and the shoulders, which are trying to lift the body from the extremities. Notice that the posture in this picture is just one posture possible for lack of perineal lift. There can be many, many other kinds of postures. Note that this is really all about using the feet and inner legs to create the perineal lift. It is not about the end result in the torso or neck. There are no clear abdominal findings for this type, but rather lack of use or tone. Because REN9 reflects weakness in the mesenteric tissue, there is a strong correlation between this type and the REN9 pulse. Basically, this is about lack of coordination between the 3 dantians, lack of perineal floor activity leading to collapse, and the other 2 diaphragms, the chest and the throat diaphragms. Because most of my observations are about a lazy way of using the body rather than palpatory findings, I prefer to classify this type by the rule of, if these points work, it must be this type kind of thing. To extend is Shen. The character shows 2 hands coming together to squeeze, to extend. The character Ju, to lift, also shows 2 hands coming from the side to extend. That implies that to extend the person between heaven and earth, to lift them, to create space in them, must be aided by squeezing from both sides. And as any dancer will tell you, the easiest, the most convenient place to lift someone is from the hips. That is why Mushu is the main point for this pattern. But the pattern starts with the feet. Usually I use kidney 6 in order to activate the Chow vessel, but one can also look at spleen 3, liver 4, and stomach 41, as well as the Jue points. The activation of the foot should cause an activation of the inner thigh, hence the use of inner yin. The inner thighs now create the suction of the perineal floor and the space, the hollowness in front of the spine, all the way up to the neck, describing what the yogis will term the 3 bandhas. The top part is at stomach 9, or just under the chin, where many people will have tension just below the teeth. One can also opt to use UB2 as representing heaven, the upper dantian. So the combination for this pattern is kidney 6, inner yin, Mushu, and either stomach 9 or UB2 or the points under the teeth. There are other structural types that we should address when we see them. They affect not only musculoskeletal issues, but so-called organic issues as well, because they affect the circulation and nerves. The Viscertosis type is another sinking type. It is typical in overweight persons with a large abdomen, as well as with women with large breasts or women after a hysterectomy. In all cases, there is pressure on the inguinal ligament and a pulling forward of the lumbar spine, a hyperlordotic posture because of the extra weight pushing on it, or in the case of surgery, the removal of an organ and the descending of the other organs into that space, weakening the mesenteric tension. This will reflect on the inguinal ligament itself, stomach 30 to gallbladder 28 area. The symptoms may include back pain, shoulder pain, and frequent urination. The treatment is stomach 13, needled outwards along the clavicle. This is the main point to release the inguinal. Supporting points are gallbladder 26, inner yin, and the immune points. This can also be used in late pregnancy as the pressure on the inguinal ligaments and the hyperlordosis start to create sciatica. In that case, use stomach 13 needled out as well as the immune point and inner yin. I would not use gallbladder 26 in late pregnancy. Tension on the inner thigh or inguinal ligament in general must be released. Because the abdominal circulation comes from the legs, and blockages in the inguinal or inner thigh will prevent you from being able to fix the abdomen. The inner thigh can be released according to the zone. The kidney, the most medial area, is usually released with kidney 7. The liver zone, around liver 12, is released with liver 4. And the spleen, the most frontal area, is released with spleen 9. The inguinal can be released with the immune point or liver 4. If there is still some pressure pain and the abdominal findings are still not responding to your treatments, needle the inguinal directly, down and out towards the leg, and or needle the inner thigh up and inwards towards the torso. The basilar artery insufficiency type reflects as tension on the cervicals. The vertebral artery curves at C1 and becomes the basilar artery, and that curve is susceptible to congestion, which will reflect further down, lower on the cervicals. The blood supply to the posterior brain is affected and will manifest as dizziness, blurred or double vision, weakness of the legs, the quads, loss of balance, and pain when turning the head from one side to another. This can also develop into stroke. This symptom list may not seem like this creates an important type of it, but in practice, this finding is quite common, even though the symptoms, as listed, are not there. Releasing the cervicals can be an important first step in any treatment. The treatment points are Sanjiao 8, liver 8, and kidney 10, all on the same side of the tight or painful cervicals. Note that Sanjiao 8 here is used on the same side, whereas when we use it to release the SCM, we use it on the opposite side of the SCM. My own version of this protocol is Sanjiao 8 plus kidney 7 or kidney 9, plus either liver 8 or inner yin, or possibly liver 9. I choose the points that best release the neck. At times, I might use only Sanjiao 8 or Sanjiao 8 plus kidney 9, or whatever shortcut I can get away with. As always, for a rapid pulse patient, Sanjiao 5 can be substituted for Sanjiao 8. On the back, we use Ihikon, that is UB60 needled against the channel, UB58, and UB40. However, note that UB40 is not at the center of the crease, but lateral to it. Think of it as UB39. I take it about its son above UB39 at the lateral edge of the triangle of the popliteal fossa, and I needle it towards the center of the fossa. This is the location and angle I originally learned. In more recent times, Kiiko seems to take UB39 and needles it at a 90-degree angle. Any head injury could be extremely important. The brain may have been affected, and therefore the whole disposition of the patient and their ability to create new connections in the body could be affected. The site of the injury is important to check, but also points on the opposite side, because in a concussion, the brain is thrown from the site of impact and creates impact on the opposite side internally. Checking and releasing the neck, the SCM, cervicals, and occiput and mastoid are essential in head injuries. For a Shaoyang injury, use Sanjiao 8 and gallbladder 40. Because of the counter-side phenomenon, do not assume which side this is likely to be. Definitely check for SCM tightness and use opposite Sanjiao 8 and gallbladder 40. But on the same side, those cervicals can be congested, in which case you will need to also use same side SAJA 8 to release the cervicals. If the pulse is rapid, SAJA 5 and gallbladder 41 are likely to yield better results. For Taiyang zone injury, use EHICON, which is UB60 needled against the flow of the channel, UB58, and UB40, which is really UB39 or UB58, in which case needle it towards the center of the popliteal fossa. EHICON is an acronym for the point names UB40, Weizong, or Yizong, hence the E in EHICON. He stands for Feiyang, or Hiyang in Japanese, and Kun stands for Kunlun, UB60. In any brain injury or damage, look for a nodule just above kidney 3 and needle it upwards. You may also find gumminess around DU4. T2 to T5 are also important for any head injuries or problems, especially T4 and T5. Another injury to look for is the tailbone injury. This could have happened in early childhood, in skating accidents, horseback riding accidents, or falling off ladders, or other situations as an adult. Tailbone injuries can affect the whole spine and the nervous system and should be addressed. However, I rarely start by treating the tailbone, simply because it is easier to check and to treat it when the patient is lying face down. Palpate the tailbone itself, below it and to its side. I do this over the patient's underwear, which is psychologically more comfortable for the patient. The treatment points for tailbone pain are UB66, lung 8, and C7 T1 Huatou. These can be on either side, on both sides, and any one or combination of the points may be needed. Like the tailbone, the nose, being the other end of the DU channel, is extremely important to treat. Besides nose injuries, having great possibility of affecting the jaw and sphenoid bone as well, they clearly affect our breathing, which means they affect the chi as a whole. Theoretically, nose problems may reflect as pressure pain around the navel, but this is not common in pure injuries and shows more in cases of allergies. Check the nose area very carefully and release with the immune points and DU 23. If the sphenoid bone has been affected, also treat kidney 9 and kidney 27 and Sanjiao 8. For deep nasal tissue inflammation, use Ocumoxa on gallbladder 40. Find the puffy sore spot just below gallbladder 40. Any nose injury may also be considered the gateway to a head injury and can affect the brain as well. So look at head injury treatments, Sanjiao 8, EHICON, etc., as you check the effectiveness of your treatment so as to address the cascading traumas that might be involved. Kiiko needles B-tongue, large intestine 20 area, at the most sensitive spot after having released it. I tend to either use magnets or diode rings and avoid needling the area. You can also offer the patient magnets to tape on at night, using north facing on the more painful side and south facing on the less painful side. This treatment works quite well for snoring too. On the back, use DU 2. The TMJ part is also an important structural type. TMJ can affect the head and create headaches. It can affect the ears. It can also be involved in dizziness. It is highly correlated with stress and nervous system disorders, and it can also affect the neck, making it a treatment priority for many systemic issues. Kidney 9 and kidney 27 are usually used, but it is also possible for another kidney point to do better than kidney 9. Sanjiao 8 is used on the same side of the jaw tightness. The point just behind gallbladder 21 releases the jaw. Although metal water treatments do not represent a type, they do represent a diagnosis we apply often. Checking the fire points of all or selected channels is helpful in offering us supplemental diagnosis points and treatment options. If a fire point on any channel is painful, use the metal and water points on that channel. Water overcomes fire, and metal nourishes water to overcome fire. In cases of systemic inflammation, as in autoimmune disorders, use the metal and water channels, that is, the kidney and lung channels, to overcome systemic fire. In shingles on the abdomen, check all the fire points, because any channel might be involved. All the channels go through the abdomen. In digestive issues, always check liver and spleen fire points and use metal water, as well as stomach and gallbladder fire points. The spleen-liver type will tend to show more in the diarrhea and IBS type, and the stomach and gallbladder pair will show more in the constipation type. Spleen 5 and liver 5 are anti-inflammatory points, used especially for the lower jiao and gynecological issues. Stomach 41, which is taken one tendon from the gallbladder side and needled towards gallbladder 40, is used as a systemic anti-inflammatory point in joints, in muscles, as well as in the intestines. Note that the regular stomach 41 is needled towards kidney 6, and that is used as part of stomach chi for structural issues and for knee issues. In skin problems, as well as for systemic detoxification, look at kidney 9 and large intestine 15. Confirm the points by their ability to clear abdominal reflexes. In the case of people with clear toxicity in their history, such as exposure to chemical waste, paint fumes, etc., use the liver and the thyroid as your first option reflexes. When a person has had chemical or toxic exposure, this can be their main type, their main or root treatment. For poison oak, poison ivy, itchy or oozing skin, and eczemas, add OQ, moxa, on liver 5. Moxa on large intestine 15 should be done until the patient feels the heat at least 15 times, and on liver 5 at least 21 times. However, these numbers are obviously not exact. They are really meant to say more than the standard amount and a fair amount more on liver 5. If you like, you can just keep asking the patient if they feel the cone, but I just do the moxa until the area gets a pink coloration for regular points, and then for liver 5 and large intestine 15, I just keep going for a few more cones, 7 or 10, or maybe 12 in the case of liver 5. UB63 is called boil point. Its actual name is Jin Men, gate of metal, which also implies its connection to skin and to the intestines through metal. It is a good friend of spleen points, which we use when there is diarrhea, and also used for skin problems when there's actual boils. People sometimes say that Kiiko only cares about slow and rapid pulse. I think this is incorrect. It is based on the fact that often in class, Kiiko will treat patients without even checking the pulse. I believe this is because pulses are just very hard to teach, so the concentration in classes is on the abdominal reflexes. But that does not mean that we do not pay attention to pulses. Kiiko has definitely taught her understanding of Nagano's pulse interpretation, but naturally, for us, receiving it once removed, it is harder to implement. Personally, I take the pulse on every patient. I prefer to take the pulse with the patient lying down, with a hand resting on the abdomen, so the wrist is up at the level of the heart. You can also take the pulse with the arm resting on the table. Although the hand is below the heart, it is certainly not too far below it. And that would also be the case if you took the pulse with a patient sitting down, resting the wrist on the desk. The hand is still below the heart at that state. Not every patient's pulse speaks to me, and the pulse may not give me too many clues either. When it does, though, I will follow those clues and confirm the ideas it gave me by checking how much the implicated points can change the pulse. Unfortunately, My ability to sense changes in the pulse and my confidence in my interpretation are not that strong, so I always also look to check the point selected from the pulse against whatever abdominal reflexes I found. This gives me a double confirmation. One confirmation by feeling a change in the pulse, if I can feel it, and another by changes in the abdominal reflexes. A short, weak pulse with no chair position implies lack of blood. The treatment points would be spleen 6 and the pericardium, meaning check pericardium 8 and needle accordingly. You can also use spleen 6 and 9 with pericardium. This is the main treatment for the anemia type. A pulse that moves only up and down with no movement forward, no wave, is called lack of stomach G pulse and is treated by use of the bumps along the stomach channel on the lower chin, close to the bone, needled down and towards the bone with the addition of ocumoxa. Needle the left side first. A pulse that disappears in the middle guan right side, the spleen position, is considered a spleen-deficient pulse and is treated with spleen 3. A flooding left sun heart pulse indicates possible cardiac issues and the use of REN4 if the pulse is rapid or UB27 if the pulse is slow. A wiry pulse, which is an excess pulse, indicates gallbladder 39 needled upwards against the channel and spleen 9 needled upwards. This pulse can show in brain damage, Parkinson's, or other brain disorders. A tight pulse, which is tight or tense quality but changes upon pressure, indicates sympathetic dominance. Use the point under the third toe and adrenals. Before we end, let's look at some popular points that we tend to use in certain conditions. They're sort of synonymous with these conditions, reflexes or types. Often a patient will become type X, meaning you know that the essence of the diagnosis is to treat that type. And often they will be a point X patient, meaning that point X is the essence of the treatment, the most important point for them. The patient may be of more than one type and of more than one point. I will often notate them as type X, Y, and Z and point A, or something like that. This gives you a shortcut into the essence of the patient from a treatment point of view. A patient with endometriosis or inflammatory conditions in the lower jaw becomes a liver 5 type in all likelihood. A patient with cysts or fibroids is likely to be the liver 8 type. Water retention or bleeding tend to become spleen 7 types. An appendix removed will tend to be spleen 9 type. A patient with inguinal tension, TMJ, or toxicity will tend to be a kidney 9 type. A patient with bone problems, ovary problems, or pain on kidney 2 will tend to become a kidney 7 patient. The lack of stomach G pulse tends to indicate stomach G. A wiry pulse or scoliosis will make it into a gallbladder 39 type. Hormonal types will go for UB66. Blood pressure disorders and people with autonomic nervous system tight pulses with a rapid pulse will tend to be under the third toe as a major point. Autoimmune and cardiac disorders are a REN4 type. Rapid pulse types tend to go with REN6. Neurological conditions and problems with the spine are REN12 types. Autonomic nervous system and spine problems are DO2 types. People with immune or lymph issues, nasal issues, REN12 pressure pain, or temporal headaches will tend to be immune point type as their major point. A tight SCM, tight cervicals, or a person who cannot relate to the body and say if the pressure pain is better or not, will be a Sanjiao 8 type. Sanjiao 5 will be the same, and it is also very important in pain. Sanjiao 5 will be used when the pulse is rapid. We use pericardium points in blood disorders. When we combine it with the spleen in insomnia and emotional problems, we choose the pericardium point according to pressure pain on pericardium 8. We went through lots of protocols and lists of points. It can be confusing at the beginning to decide on how to prioritize and what to treat, because patients often come with lots of symptoms and abdominal findings, and sometimes with not enough for us to have clarity as to how to proceed. At first, I recommend just getting used to palpating the abdomen and resolving reflexes. This is the stage when you will still be using TCM or tongue or whatever other method you're currently using. Start by just palpating the abdomen on patients as if for fun, with simple curiosity. You do not want to build up the expectation in the patient that you must clear the abdomen. You're simply playing, and if things clear up, that is cool. This is your learning phase. Do not put too much pressure on yourself. At this stage, you're still working mechanically. You will find certain reflexes, and you're playing with standard protocols to clear those reflexes. This is how you build up your confidence and your repertoire. As you get more confident and feel you know more of the protocols, you can start to play with them and be more flexible. You may well discover that you have slight variations on the protocols. If now you opt to get deeper into this style, and I certainly think it is a worthwhile venture to do so, you need to start prioritizing your treatment strategies. While I do not recommend you necessarily drop all your previous habits or favorite points or your knowledge, I suggest that you try and apply everything you can while checking to see what it contributes to clearing the Hara, and to see how much you can put it in the context of finding the root type and fixing things in the medical history that you probably have been ignoring in your treatments up till now. One of my students says they use so-called Kiiko style, but they're using the points on the hand according to the Korean method. Anything is possible. You can decide how to apply this style in your own way. Let's take one last look at how to start the process of prioritizing. We already know that we need to look at the medical history. We correlate that with the physical findings, the reflexes. We do not start the process until we have gathered all the information, that is the medical history and the physical findings. Now the fun, the creative process begins. These are some guidelines that are helpful in going through the process. And like any guidelines, these so-called rules will be broken time and time again, and yet they will still be useful. Start by looking at whether chi and blood are moving well enough. This comes from the pulse to a large extent. Is the pulse very weak? This suggests that there is not enough blood, and you may need to boost the blood first with spleen 6 and pericardium to start addressing anemia. Does the pulse show lack of stomach chi? This suggests start with stomach chi points. Is the blood pressure low, or is there a weird gap that is not near 40 between systolic and diastolic? This suggests adjusting the blood pressure and nervous system first. It doesn't mean you must start the treatment with these, but that these are very likely to become priorities, and if they're not addressed, you will not be able to proceed with the treatment. Reflexes will, quote-unquote, refuse to be cleared until the circulation and signaling are better. This also doesn't mean build up the blood in the way we would with herbs, waiting for the next move for possibly weeks and months. We will do it all in one treatment, in the same treatment, except that we know that part of the treatment must be to boost the blood. Next, we look at factors that prevent blood, nerve, or lymph flow. Does the patient have a tight SCM? That means lack of parasympathetic feedback, which is primary for all healing to take place. Are the cervicals tight? This may prevent clear communication between the body and the brain and needs to be addressed. Are the inguinal or inner thigh blocked or tight? This will slow down circulation into the abdominal organs and therefore interfere with the ability to clear the abdomen. Clearing the neck is one of the first things I look at in all patients, regardless of what else I need to address. Again, I'm listing these as priorities, but they do not have to come in this order. When I treat, it is just a flowchart that helps us with suggestions. Now we look at the major types. Most patients tend to fall into these types, and when you address those, other findings will tend to be addressed also. Look for adrenal, 4 o'clock and 8 o'clock, as well as kidney 2 pressure pain. Consider stress and traumas as creating stress on the organism of this patient. Look for immune issues in the patient's history, as well as SAJA 16 pressure pain and right stomach 26-27. Is the nervous system pliable? Does it adjust easily? Is it flexible? This may reflect in the body as a tight SCM, as weird blood pressure, as an inability to connect with the body and give clear answers, or it can show as the pulse. It is essential to soothe out the nervous system. Is there a pulse on REN9 indicating a weak lower dantian? Without tone in the lower abdomen and a pelvic floor lift, there is constant weakness and drain on the system, and this needs to be addressed. Are there endocrinological disorders like thyroid, estrogen, or sugar issues? Those affect cell metabolism in the whole body, and again, they need to be addressed. Are there any systemic diseases, diabetes, autoimmune disorders? Those will need to be addressed as primary causes usually. Cardiac patients, or those with clear cardiac family history showing cardiac reflexes, should have the cardiac part treated, because otherwise we can create a situation where we are fighting against a hampered circulation and actually make the person feel worse. Having looked at all those, now we can start to address whatever was not looked at up to now. Any abdominal reflexes that were left uncleared, any symptoms that need to be addressed, any medical history that hasn't been looked at. In spite of all our efforts to classify important types, there will always be the kind of patient where addressing the infinitely important adrenal will not hold a candle to addressing some weird pimple on the index finger or the equivalent of that metaphor. Every patient is unique, but there does seem to be a priority, a sequence of importance of what tends to be more root that most people tend to follow. You can use this style and use points that Kiiko might have never used. The essence of this style is not the points, but a way of thinking that looks at finding the root cause rather than just a pattern. And it looks to confirm the diagnosis through objective changes in the body reflexes or in the pulse, if that is available to you. You can incorporate different acupuncture styles and points into this style. In my opinion, there is no purebred Kiiko style, or any other style for that matter. We are always learning and incorporating new findings, new ideas, new effective methods. Perhaps no one does this more frequently and more successfully than Kiiko. This is a dynamic style. You will find that with your patients, there are other types, other categories. You will find points that work for you. You will also see changes in patterns in patients as years go by, and as your understanding of medicine in general and of the mechanisms of disease changes and grows. We bring in new treatment ideas, new patterns, new points all the time. Having the basics is very helpful. It will likely take you a few months to practice this material and get confident and fluent in it. And that is when it is time to challenge yourself. Taking class with Kiiko or with anyone especially teachers who treat real patients in class, demonstrating how they think, how they get stuck, how they get unstuck. This is an essential part of recreating ourselves. This class is just the beginning. Perhaps the most important advice I have to offer is do not be afraid, experiment, use your imagination, and have fun. Part 3 of this class, the next video, presents no new information and consists of a video of 2 cases treated in a class. This offers you a way to integrate some of the information so it will be easier to put into practice.